Since early 2020, the world has been in the grip of a pandemic that has cost millions of lives and affected billions more of us through economic contraction and restrictions on our movements. Much of this story is well documented, but the crisis has thrown up a question that so far received little attention. Have measures taken in the name of defeating COVID-19 also done lasting damage to our civil liberties? We've been in search of answers.
The coronavirus pandemic has forced governments around the world to take extraordinary measures, closing cities, banning travel and making people stay at home for months at a time. In the race to defeat the disease, they've also had to gather huge amounts of data about our whereabouts and our state of health.
Digital contact tracing tools offer the opportunity to trace larger numbers of contacts in a shorter period of time and to provide a real-time picture of the spread of the virus.
But privacy campaigners are now asking if all the new laws, technology and data gathering has been strictly essential.
The way I like to frame what's been going on since the initial stages of the pandemic has been, first, governments panicked. And they panicked because they recognized that they didn't have the infrastructure they needed. And so what did they do? They used the infrastructure they had, which was intelligence agencies, policing. And in the absence of any capability of testing, they thought, is there a way for technology to solve this problem?
What we know is the crisis is the ground on which long-term erosions of our liberties are seeded. But it can feel really difficult making civil liberties arguments in the context of a crisis. You know, whether that is 9/11, which we've all learned an awful lot from, whether that is the pandemic, because you're often painted as you don't care about public safety or public health.
But exactly how have our civil liberties been eroded? What's been going on under the cover of COVID and where? Back in March 2020, the high-tech city-state of Singapore was one of the most enthusiastic adopters of using mobile phones for contact tracing.
Play your part in fighting COVID-19 with just 2 simple steps. 1. Download Trace Together and help those around you to set it up. 2. Turn on your Bluetooth. And it is as simple as that.
As in many countries, the government said the app was voluntary, worked entirely on anonymised IDs, and is only tracking the virus, not the user.
And that's really it. No geolocation or other personal data is collected.
But digital rights activists like Lee Yi-ting weren't taking their word for it.
When tech experts examined the code for it, they found that it wasn't doing all the things that it said it would do. So, for instance, it said that the data would not be shared, would be totally anonymous and so on. They found that the data was shared more widely than it was supposed to with certain government agencies.
At first, take-up was low until the app was made mandatory to access public areas like shopping malls. Now it's used by nearly 80% of the population. But in January 2021, the government admitted the police had accessed the data for a murder investigation.
Singapore Police Force is empowered under the Criminal Procedure Code to obtain any data, and that includes the Trace Together data for criminal investigations.
Even in normally quiescent Singapore, there was concern.
It also brought up other questions for people. So what other data has been used in what types of investigations? Can we trust that this is the only time that this has happened? At the time, I was volunteering quite heavily with a sex workers' rights organization. And one of my concerns was that the data from contact tracing could be used to identify sex workers and their clients. This has your Trace Together history. So over the past 25 days, these are the number of times that other devices with Trace Together have been pinged. And given that sex work is criminalized in Singapore largely, I had some concerns there.
There is evidence to suggest digital contact tracing can be more effective than manual tracing, but privacy campaigners fear these methods of surveillance will outlive their initial use.
That's going to be one of the legacies of COVID, the whole idea that your mobile phone and an app and the telecommunications infrastructure designed for you to enjoy spending your time communicating with others will be used to enforce your own detention in the future.
In Israel, the government also employed mobile phones for contact tracing, but used a method that raised even more privacy concerns. While ordinary people struggled under heavily policed lockdowns, the pandemic let Prime Minister Benjamin Netanyahu divert public attention from fraud and bribery allegations. But demonstrations against corruption and the government's handling of the pandemic erupted anyway. Or Biron was a regular protester. During one of the lockdowns, when outside meetings were permitted, she met up with fellow activists.
This is what we were doing that night. There was a party, a birthday party of one of my friends. Then the police just came. We were starting to harass us and just wanted us to leave. A few days later, I got the text message. It says the date and the hours. You were near someone who was tested positive for coronavirus. You have to immediately start a quarantine.
This might seem normal for many countries, but an emergency regulation had allowed the Shin Bet, Israel's secret service, to run its track and trace program.
אין נמנעים. התקבלה בקריאה השלישית ונכנסה לספר החוקים.
Civilians cannot opt out. They can't even opt in. It's just the Secret Service is tracking all civilians, anybody within Israel. We are the only democracy in the world to this day that was using their secret services to do this.
The Shin Bet are often accused of breaching human rights law in their treatment of Palestinians, but the revelations showed that they don't only operate in the West Bank and occupied territories.
The reason this happened is because the Shin Bet already is tracing people. Instead of waiting for something new to be created, they already have a tool within the Shin Bet.
The tool was a secret, years-long program to monitor telecommunications across Israel and Palestine.
I felt really angry because I had a feeling that because we were there, like many people from the protest, it happened just about this event.
It's an open question whether she was forced into quarantine because the state was targeting protesters or merely protecting citizens from a deadly disease. But civil rights campaigners say that with Shin Bet doing both, nobody would know.
In a democracy, it can't be that there's a surveillance state in the sense that a government can track certain people. This can lead to a situation where the government knows about your sexual orientation, about your political orientation, and what it can do is lead to a freezing effect, the phenomenon where people don't want to go outside and do certain things, let's say protest, because they have a fear of being tracked.
After several legal challenges, the government says the Shin Bet surveillance has now been scaled back. But the scandal opened at least some Israeli eyes to the way Palestinians are routinely monitored.
I think that we finally have to fight against it in all areas. It doesn't matter if it happened to an Israeli citizen or to someone at the occupied territories. This is really, really bad. This is a slippery slope towards violating human rights.
In the early stages of the pandemic, other governments also experimented with electronic mass tracking, but with only marginal success.
Ultimately, it was recognized that this level of mass surveillance doesn't actually help you with a pandemic. So they decided to resort to what they do often as a next step, which is rely extensively on industry to sell them toys.
Your symptoms show that your health may be at risk. I would recommend you to visit a doctor.
The industry many governments turned to was biometrics, which uses unique personal traits like a face, iris, or fingerprint to identify people. For China, which was already openly using facial recognition in its big cities, the pandemic turbocharged the rollout in smaller towns across the country. The claim that biometric and contactless transactions are safer has obvious appeal for airlines keen to get people back into the air, says the CEO of Qantas.
Contactless travel, and people now, we're seeing a huge move to that. It's 8 years move in the space of a few months. We think that is a change that will stay there forever.
It's also a change coming to retail. This leading Russian supermarket has teamed up with Visa so you can pay for your shopping with your face.
A lot of this is a sort of form of tech solutionism, which is the idea that technology, because it's shiny, because it's new, contains all the answers to all of our problems. And many people sort of unquestioningly trust technology or assume that it's going to be the most efficient or the best solution.
But critics say biometrics is an industry with a checkered past.
Around pre-9/11, where facial recognition was being touted by police, particularly in the United States, as the great solution to policing problems, without recognizing that their own forces had turned off the tech because it wasn't actually working. Then 9/11 happens just months later, and all of a sudden governments are reaching for facial recognition and fingerprinting. So we deployed them at borders, we put them in passports, without ever asking, who does it work for? When does it work? When does it fail? What happens to somebody who it fails for? Do they just get detained because something doesn't match?
The biometric industry, Hussain says, goes where there is opportunity, money, and few questions.
A few years go by, industry's looking for a new market, and they then decide to go for the next great domain of policymaking where we don't care what happens to people. And that was in the migration sector and refugees and refugee camps. So refugee agencies and governments were sponsoring refugee agencies to deploy fingerprinting, iris scan, facial recognition. And again, I got a close-up view of some of these in refugee camps. The only people who didn't realize that the technology didn't work were the policymakers. Everybody else knew the technology wasn't working, but it didn't stop the sale, the reliance, and the shaping of people's lives based around yes, no, did the system say you're allowed in, or did the system deny you because it failed?
Campaigners say these systems are often first tried out away from critical eyes in the West, like biometric voting, which has been trialled in Afghanistan, Uganda, and here in Iraq.
With a pandemic, maybe we can use facial recognition with people's faces covered. Maybe we can use cameras to track people across cities to do contact tracing. And in a post-pandemic era, we can use facial recognition at borders, we can use facial recognition in shops, we can use facial recognition everywhere. And then we've forgotten why we deployed it.
With biometrics and biosurveillance, there is a real risk that our kind of personal identities, our faces, our fingerprints, our irises, we can't change those. They will be locked into a system forever. They can be exploited by hackers, they can be exploited by unscrupulous governments. And then we're stuck. There's no way of resetting your face. It's not like a password. This is a kind of a permanent solution to a temporary problem.
The temporary becoming permanent is just one of the concerns campaigners have around the NHS Data Store, a giant computer system built using the personal data held by Britain's National Health Service.
Where do you live? And have you suffered from any allergies before?
No.
The NHS holds personal information on over 60 million people, often going back decades.
The NHS has one of the biggest stores of patient records going back through time. Globally, it's a standout in terms of the amount of data it has, and it's worth, billions of pounds. And data is the new oil, as we know. Data is money.
Normally, NHS data can only be used by those treating a patient, but when the pandemic struck, the rules were loosened.
In March 2020, the NHS announced that they were setting up something called the COVID-19 Data Store, and that they'd entered into 5 contracts with different tech companies, and that data store was going to be the kind of single source of truth about the pandemic for the NHS.
The data store pulls together information from across the vast NHS, including confidential details given to the 111 helpline and even tech company location data. This would supposedly help ministers allocate resources by providing them with a real-time dashboard of all aspects of the pandemic. But from the outset, almost every element of it worried privacy campaigners.
It was extremely vague. We didn't know what data was going into it. We didn't know how it was being used. It was, very secretive. And it emerged that the first contract had gone to Palantir, who had built the backbone of this, for just £1, which obviously sounds quite altruistic.
Palantir Foundry is a software platform that allows organizations to bring their data together and then enables their users to conduct sophisticated analytics and operations on top of the unified data.
Palantir have been criticised for providing its data mining capability to the CIA and the US Border Force Division, ICE, responsible for detaining and expelling migrants.
They are not particularly well known for health. They are much more well known in relation to their defence contracts, their spy tech, the US police forces. They are not a company that certainly we would immediately think would be appropriate, and indeed we don't think are appropriate for an NHS contract.
But the British government didn't seem that concerned. When asked by a technology journalist what Palantir might hope to get from a £1 contract, the Secretary of State for Health replied,
"The honest truth is there is no way we would have been able to cope with this pandemic and deal with it in the way that we have been able to without the support of the tech companies. They have been absolutely brilliant at putting together the platforms that we need, and lots of them gave over their time and their capability for public benefit pro bono."
Rosa Curling's organisation Foxglove, a UK law firm set up to challenge big tech, took legal proceedings which forced the government to reveal the contract, which was for a pilot or trial project. The contract also detailed the types of data being used.
What we did see was that the COVID-19 Data Store was collecting data on political affiliation, religious beliefs. It was collecting information about criminal convictions, ethnic data, employment data. There was no understanding of why political or religious data was needed for, a COVID-19 data store.
And much of this information is irrelevant to scientists battling the pandemic. Dr. Paul McKay works on Britain's vaccine programme.
We have no interest in what people buy or political affiliation or any of that type of thing. We're just interested in the virus, how many cases are being picked up in a certain place, and then using that data to try and target interventions. It's mainly the genome sequencing that is guiding what we do.
Privacy campaigners also worried about mission creep, that once set up, this huge system would continue in operation after the pandemic and expand into other areas. The government promised it was temporary, and then Palantir signed a new deal for £23 million. Rosa went back to court and was allowed to see the new contract.
The paperwork made clear that the mission creep was there. So the contract itself set out and confirmed the purpose of the data store was going to be increased and widened, and that other issues were going to also be looked at. So the EU exit, business monitoring as usual, whatever that may mean, relevant pandemics, the flu.
The government declined to respond to us directly, but as the story was unfolding, the NHS said,
"Strict data rules apply to everyone involved in helping in this critical task. The companies do not control the data and are not permitted to use or share it for their own purposes. At the end of the health emergency, their work will either be deleted or returned to the NHS."
In April 2021, Palantir became an official UK government supplier. They've also signed contracts with other European governments, including Greece and the Netherlands.
The health ministries of the world are just, they're such prime targets for this industry. That is, they're sitting on a lot of data, don't know what to do with it, and then suddenly a salesperson's knocking on their door saying, "Hey, we have experience from building policing systems, border systems, immigration systems, on taking mounds of data, mining it, and finding something interesting. Why don't you use us, and we will help you." But it's our most sensitive and personal data, our health data, and it's being used to essentially build the next generation of profiling technology.
But it's not just governments that are accused of monitoring people under the cover of COVID.
Good afternoon, you're through to Brian. How can I assist you today?
As millions around the world are now working from home like Brian, unions are raising concerns about the new forms of surveillance.
So I'm just going to get your billing open now and we'll see what we can find out.
Brian's employer requires him to account for every second of his day.
So when I go to the toilet, I have to click into basically what's called a code. It's basically to notify them where I am at that time. So I've had team leaders, if I've gone to the bathroom for maybe a minute extra when I get back, there's a few messages going, where are you, mind your time, get back on calls. So you're absolutely being monitored in real time.
Call centre work has long been heavily monitored, but it's intensified with the move to working from home.
We got a memo saying that we would all be getting sent webcams out and a list of clearly stated mandatory reasons. I don't want people I've never met to see my bedroom, which I think is reasonable. There's also like a gendered element to it. Like, I don't know, if I was a woman, I wouldn't necessarily want some man I've never met being able to just randomly view my webcam.
And in a University of Strathclyde survey, 45% of all people working from home in the UK said they are remotely watched. In the empty office of the Prospect Union, Andrew Paik is worried.
What we've seen in the last year is that hand reach out from traditional industries where micromanagement is more common into all walks of life, whether it's office workers working at home, whether it's other forms of professionals.
A study by digital rights organisation Top 10 VPN showed US sales of surveillance software increased by 51% during the pandemic.
You've got software now that can measure your keystrokes, how fast you're typing on your laptop or what words you're typing. It is easy now for employers to check your emails for keywords, whether you're chatting to different workers and who you're responding to.
Brian gives us a flavour of what this feels like.
We have an employee forum. When the webcams were announced, that was one of the few times people were outright angry. There was a thread that disappeared, so that just vanished suddenly. There was then a second thread, and there was people within that thread saying, I've been told I shouldn't keep talking about this.
The pitch is that analytics allow companies to improve staff productivity, thus increasing profit. But Brian thinks employers benefit in other ways.
It's also a sort of repressive measure. I think workers are much less likely to organise, are much less likely to forget industrial action, even speak to each other.
This tracking is a global phenomenon. Amazon caused uproar when it announced the rollout of AI-enabled cameras in the USA that monitor neighbourhoods and their drivers.
Pressing and holding the driver alert button for 5 seconds will turn the driver-facing camera off so you can have privacy while taking a break.
Coronavirus has been the opportunity for businesses and for governments to massively increase their power, to increase their surveillance, to increase their kind of control of every kind of minute area of our lives. And to roll that back is going to be very difficult. Once these things are introduced, for the greater good, for our own safety, for our own health, in the guise of public health.
Civil rights advocates fear this surveillance will be extended by the same measures many countries hope will allow travel to resume.
Health passports. Many leaders see them as a key to normality.
The almost empty resorts of southern Europe have helped convince the European Union.
With this digital certificate, we aim to help member states reinstate the freedom of movement in a safe, responsible and trusted manner.
Israel has reopened gyms and hotels with its Green Pass, currently a QR code showing vaccination status. Many, including vaccine scientists, think they are inevitable elsewhere.
I don't personally like the idea of a vaccine passport, but obviously if another country insists that we show that we have been vaccinated and we want to go to their country, we would have to have a vaccine passport. Obviously for local use, I think it's a terrible idea. It would discriminate against people.
But for civil rights campaigners, the dangers go much deeper.
Discrimination wouldn't be a side effect of this. Discrimination is the whole point of this. The whole point of a COVID passport would be to create a two-tier society where the wealthy with their shiny COVID passes can, go into their special vaccinated-only hotels, vaccinated-only restaurants, vaccinated-only airplanes, and live a kind of continued privileged life, while those who are unable to show the right digital pass are locked out of society permanently.
In fact, critics fear all of the intrusive new technology that appeared during the pandemic is here to stay.
You don't build all that tech to then just easily shut it down the moment that the WHO says it's no longer a pandemic. 9/11 allowed for the use of identification at borders and for transport in a way that we never had. And what governments have never had the capacity to do before was to add the next desirable layer, which is health, medical, and detailed personal information. And so we'll have built the infrastructure for all of that, and all of a sudden you have the perfect identity system involving biometrics, modern software, smartphones, all to fight a pandemic that one would hope that if you deploy the vaccine sufficiently, you don't need a passport anymore. But you'll have an identity system as the end result of this entire initiative.